Thank you very much, Sue. I am very pleased to be here. Thank you so much. Yes, good morning, and I'm delighted to welcome the return of the All-Ireland Maternity and Midwifery Festival. I feel very lucky that I sat and listened to this opening given by Maeve Gaynor, midwife representing the INMO last year. Doesn't it seem like a very, very long year? Of course, the importance of issues have radically changed this year of the festival. COVID-19 is our #1 challenge. The Department of Health states that for the week ending 17th of January, there were 846 cases of hospital-acquired COVID-19 of healthcare workers. As far as I'm aware, there is no specific breakdown of how many of these were midwives. To date, I do not think that any midwife has died of COVID-19 in Ireland. My sympathies, though, to the UK, where Sue MacDonald in last month's Midwifery Hour said that 7 midwives had died of this terrible disease. I think that Ireland seems to be dealing well with the disease, issuing remits of the FFP2 masks to wear, prioritising vaccinations for frontline staff, and giving clear guidelines from the Department of Health and NPHET. I am aware that this is not clear across the board or well rolled out, with some hospitals receiving no vaccinations as of yet, and others have had their second vaccination. I am so pleased that the INMO has been our strong voice to government, getting clear letters of instruction and recommendations. Of course, there's more that everyone can do. And to address this, I thought I would try to get our midwives to give their voices to the midwifery issues, challenges, and for their thoughts on women's issues. I also asked what are the positives and negatives at present. I received some very detailed responses. So I'm going to share my screen and start that. Okay. This was me having asked midwives on text and on all the various messages that we all have these days on Viber groups and WhatsApp groups. I also sent an email to all of the INMO midwives that we have as well, and asked them to give me their opinions. So it wasn't a research, but it's just to get a feel of what midwives on the ground are finding the challenges in Ireland, and that's what I wanted to ask about. The first thing, as Sue spoke about there, was our National Maternity Strategy, which was published in 2016 and supposed to be in total action by 2026. And yes, of course, COVID has put a stop to it. But before that, I'm afraid to say that it hasn't been really being rolled out particularly fast or clearly or across the board in every area. It's given the opportunity for some people to put things in place, and that's been wonderful. It is a fantastic document and we love it, and there is money to be spent on it this year, and it's been specifically allocated by government. So we will see what happens on this one. My next one that I just wanted to put in was that this day last year, this photograph went up on Twitter, and Nora Casey led the call for a Chief Midwife Officer for Ireland. WHO and the International Confederation of Midwives have specifically stated that this would be one of the really good issues or challenges for each country to pursue, would be to have a Chief Midwife Officer for every country. And Ireland doesn't actually have a Chief Midwife Officer. Yes, they have a midwife in a subcommittee, but it's not particularly laying to government the way a Chief Midwife Officer would. So that's one of the things that I wanted to just point out. So the midwifery issues that midwives were talking to me about. Midwives are concerned at the high rate of obstetric interventions at present. Midwives are seeing an increase in induction of labours, with one area noting that inductions are now term plus 7 instead of the previous norm of term plus 12. No evidence has been offered to support this change. I just looked there that the Royal College of Midwives reviewed the literature in the current COVID-19 climate and found a recent systematic review of effects of induction of labour prior to post-term in low-risk pregnancies. It concludes that induction prior to post-term, as in 41 weeks, was so benefits and several adverse outcomes. And I have the reference for that if anybody wants it. It's Riedal et al. 2019 February. Midwives say that there is a lack of choice in interpartum care for low-risk women. We have observed that women are concerned about entering hospital settings, and women recognise the lower risk environment of birthing in their own home. There has been an increase in requests for home births and in home birth bookings. In 2019, 254 women booked a home birth, and this increased to 330 bookings in 2020. 20 midwives are working nationally in this area. So there is the fact that we have to turn women away because midwives are fully booked, said Anya Hennessy in the Irish Examiner on the 28th of January this year. In Ireland, there are anomalies in maternity care. Water birth is an option for women in the Coombe and Wexford, but has been disallowed for births in the community. Home visits for postnatal women has been commenced in Limerick and Drogheda and pulled in Cork and some hospitals in Dublin. Midwifery breastfeeding services seem to have been sidelined at present. What is the impact on breastfeeding for women and their babies? Direct entry midwives have stated their career pathway is constricted, so they don't have access to post-graduation general nursing in Ireland. You can see there that the personal feelings about this particular time, feelings of apathy and environmental disempowerment, people being deployed and who are off-site because of their own risk factors, that they've not been a midwife for far too long now. Had a busy day with women and with COVID. I'm half dead from it all, it's exhausting. These were just some of the things that midwives were saying back to me. Excuse me. Midwifery, excuse me, midwifery issues, continuing lack of personal relationships being developed. Midwives are finding it hard to continue personal relationships, and actually midwife tutors and lecturers were saying the very same thing because of Zoom classes and lecturing with students, that it's that lack of personal relationships that they're finding quite difficult. Junior midwives are finding it difficult to get a midwife mentor and helping them to care for low-risk women. Lack of breastfeeding support, postnatally, some lactation consultants being redeployed, and as I said, the reduced career pathways. These were just some of the midwifery issues that people sent to me. So the women's issues as perceived by the midwives, and I'm very clear about that, it's not women's issues as asked of them. Women are so vulnerable now more than ever, and we should be doing everything to encourage health benefits of breastfeeding. The most frequent question that we've been asked is, can my partner accompany me for scans? And the next one would be, actually, is my partner allowed in for the labour? So no visiting postnatally. And women are asking, who will help me mind my baby? How do I go to the shower? And a frequent question in the antenatal clinics is, can I opt for a home birth? So that's the end of my screen sharing. The ICM, the International Federation of Midwives, and the World Health Organization both strongly state that each country should have a chief midwifery officer. Ireland does not have one. A chief midwife is the midwives and women's voice. They're a strong governmental voice, a door into government policy, an overseer of the maternity services. Ireland did have a midwifery officer under the direction of the chief nursing officer, but this was discontinued a number of years ago. The Year of the Nurse and Midwife, the WHO supports and wishes to see a greater focus on the improved delivery of midwifery globally, and calls on all countries to create this chief midwifery officer. In the future, I would like for us to have national guidelines for pregnancy, labour, birth and postnatal care. for us to become stronger advocates for women and not to be in fear of speaking up. And I've come very much to believe this year, that we are not to be scared about speaking up. And I hope and aim that we, in the INMO midwife section, will be paying more attention to that and doing more about it. Being an advocate, a strong advocate. We need postgraduate general nursing to be offered in Ireland, and I believe strongly that we need a chief midwifery officer in Ireland. Thank you very much.
Okay. Thank you so much, Lynda.